So I'm going to go through my parent hospital is now the University of Colorado. I'm going to talk about my education, so I'll explain more as I go. If I think about my career and how I've gotten to where I am today, and actually my whole life, I take the circuitous path. I don't go from A to B. I take a meandering path. And so, I'm not an epidemiologist by day. I'm an emergency room doctor. And so I tried to think about things that may not have been covered or other pearls that I could give you. So my presentation in classic Leana form is a little non-traditional. So some of the things I want to talk about today is the unforeseen path, weaving different experiences together that even at the time or a few years down the road, you're not quite sure how they fit together, and then the wisdom of, with time, how putting them together, unconventional opportunities, the role of mentorship, and really following your own true north, whatever that is for you. So I'll start with just a little bit of my career trajectory because I think it helps put the other kind of pieces that I've pulled out into perspective. So my early academic path, I went to the University of Michigan for my undergrad, where I did neuroblastoma research. Then I went on to medical school, and during medical school, I did global health work, clinical work, in a different country each year: Guatemala, Costa Rica, Kenya, and then Malawi. I was very non-traditional in that I finished medical school and then still didn't know how I would combine my interests in pediatrics, oncology, and work abroad together. And then I found this magical program called CESP at the School of Public Health. So I'll talk a little bit about how I also took an unconventional path getting my MPH. I then went and spent a year down in Texas at MD Anderson, and I'll also talk about how I didn't follow the normal path there. And I mention BPI, Baylor's Pediatric HIV program here just because you'll see that it was something else that I had no idea how it was going to wind throughout my career to today, and continues to do so. I then spent a year doing refugee medicine in upstate New York. I then went to pediatric residency in Connecticut, and I'll talk a little bit about how my MPH work led to my research during residency through St. Jude's International Outreach Program. And then I did a global health delivery fellowship at Harvard through Boston Children's, and we'll talk more about that. So what do I do currently? So I'm in Colorado. 75% of my time is spent seeing patients in the pediatric emergency room. 25% of my time is paid for doing global health work. So I'm the director of our pediatric residency global health track. I'm the associate director of global health at the medical school. So we have about 100 students doing global health work in our medical school. I hold an appointment at the Center of Public Health in the Department of Epidemiology, and then our Center for Global Health. I keep a faculty position at Boston Children's. I'll talk more about my research that I continue to do in Rwanda, and then I work with Partners in Health. The one thing I will bring up again, but my faculty position in Boston is free. It's free work, and we'll talk about the role that sometimes free work needs to play in your life to lead to other things. So my early influential experiences, I know you're a little bit farther down the track, but I think sometimes it's just good to think about maybe where you've come from and where you're going, and again, how it all kind of ties in together. So I knew at the age of 8 I wanted to be a doctor. I knew in high school that I would take a year off before medical school, and that year for me looked like time in Ghana, time in India. This was at a Mother Teresa home for the dying and the destitute I worked at, and then working with the homeless in Denver. And all of those things have continued to play out later in my career, which I never would have known at that time. This was me delivering my first baby after my first year of medical school before I had any clinical experience or knew what I was doing, which, as Lizzie mentioned, we all kind of have different thoughts on what these shorter term experiences look like. I will say that getting to do things for a week or 2 weeks early on did lead me to continue down the path of global health. If you would have told me when I even was in medical school that global health would be part of my professional track, I would tell you you're probably crazy. So these experiences do have validity, but I also bring this up because I'm getting older, even though I don't like to admit that I'm old. When I was going through training, we were cohort 2. And that was after I was done with medical school. So there weren't the kind of opportunities that are now present in global health or public health schools, medical schools, even college. So, times change and thoughts on what is acceptable also change. This is me in rural Haiti with Partners in Health. So I read Mountains Beyond Mountains when I was younger and thought, wow, this is amazing. Never did I think Paul Farmer would be my mentor and I'd be seeing patients with him in Haiti. So again, dream big and keep your opportunities open because you never know how it's going to play out for you. This is me in front of a plane in Botswana funded by PEPFAR. We used to fly to rural areas of the country and treat patients that were failing their antiretrovirals. This is through Baylor, years after I first had worked with them when I was in Texas before I started residency. So the next point in which Baylor returned back into my career. And then this is me seeing patients somewhere in my training, probably my second or third year. And I put this in here because it was in these experiences that I also figured out that seeing patients one at a time was not how I wanted to leave an impact, and really started leading me to think about public health and global health and how that seemed like a way for me to have a larger impact in the world. So I ended up going to Michigan for an MPH, and I looked at all the options and I saw the way that I could find the most flexibility was within hospital and molecular epidemiology. That degree I took one course in. I know nothing about hospital and molecular epidemiology because I found CESP, and that took all of my time. I was the last doctor that they let in the hospital and molecular epidemiology program because I abused the system, but it got me here, so for that I'm grateful. So for my CESP project, I did an epidemiologic description of pediatric brain tumors in Morocco. We were cohort 2, and Emily, who'll speak next, was in my same year, and Lizzie, who spoke earlier today, lived in my same apartment in Morocco. And it was a life-changing experience, and I still can't believe 10 years have gone by, because in some ways it feels like it was just yesterday. All right, so I bring up my time at MD Anderson and Texas Children's, one, because MD Anderson does treat pediatric oncology, but I found a way to find myself at Texas Children's because I was interested in their program for my own training. So again, you gotta work the system, and Amr is really good at that. So if you ever need advice, talk to him because he can find ways to make what you want happen. And I bring this up because this is a paper that was published last April, 2017, on work that I did in 2008 to 2009. So don't give up on your manuscripts or your projects because you never know. They can resurface years later. I mean, the research was updated in all fairness, but they kindly still left me as the first author, which I thought was very kind because I really didn't do a lot for a lot of years. All right. I'm going to talk a little bit about my fellowship because it was unique in a lot of ways. So Partners in Health for me had always been a dream organization to work with because I believe in their model. Boston Children's, #1 children's hospital in the world. And all of those opportunities led me to live on a Rwandan mountaintop, which truly changed my life. So for starters, global health to this day is not an ACGME accredited area for training as a clinician, and so I had to think about that. I had always thought I was going to be a pediatric oncologist. I remember the exact moment. I was at my Stanford interview, second year of residency, and my mouth was talking. It was giving the spiel about all the work I'd done and how I wanted to be an oncologist. And in the middle of it, I thought, I actually don't think this is the path I want anymore for myself. You know, I had always been interested, I still am interested in the same population, but I decided, do I need to be the oncologist who gives and prescribes the chemotherapy? No, I'm more interested in the health systems and the structure. So, what if I approached this from a different perspective and did global health and applied that knowledge to oncology, which is ultimately what I did, and I'll talk a little bit more about the cancer piece in Rwanda. So my fellowship allowed me to live in Boston half-time, where I worked as a doctor in the emergency room, and then live half-time in Rwanda, where I made no money but had larger impact for myself. It allowed me to attend the Global Health Delivery Summer Intensive at the Harvard School for Public Health, which is an amazing intensive 1-month program that, even though I love my MPH, I think I love that month more. It was really great. And it allowed me to teach at the medical school. So I got to teach social medicine amongst a lot of mentors I'd had my entire career and people I'd looked up to, which was a very special experience. So in Rwanda, I did a number of different things. I had my own fellow research project, I had clinical work, and then I worked at the national level. So what did that look like? So Partners in Health, their big model is on accompaniment. We take Rwandan physicians and we live and work alongside them in the parts of the country, not just Rwanda, but anywhere Partners in Health works, and we do the work that nobody wants to do. So these pictures are all with Cyprian. We call each other twins. He is a Rwandan-trained pediatrician who I worked aside for 2 years. He is a task-shifted oncologist in Rwanda. So he is trained as a pediatrician. He has not done an oncology fellowship, but he provides pediatric oncology care under the guidance of different mentors, both in Rwanda and abroad. And these are some of our oncology patients in the ward that I love so much. So part of my role in working with Cyprian is his clinical work, but it's also building his research capacity. So at Partners in Health, we have a policy that no developed country individual is going to be the first single author on a paper. We do a lot of co-first authorship. So this is a project that Cyprian and I, behind us on the wall, that we co-authored together and that he won the poster prize at the International PsyOp meeting for. And I bring this up because while I helped develop his career, he's also become a best friend of mine, and so it's really, it's magical just to see what that time on the ground together has done for both of us personally and professionally. This is a ward, or a picture of the neonatal ward at our hospital, and I use this to signify the fact that I never would do one-on-one patient care because that's not good utilization of my skills. So I did a lot of teaching. It was doing rounds with the physicians, it was working with the nurses, it was working with the research assistants. So in all different capacities, trying to really have them understand the care we were delivering and then how to conduct the appropriate research to make a difference from the work we were doing. And this is me with some of the community health workers wearing their anti-malarial campaign dresses. So I got to work at all different kind of levels of the healthcare system, which really helped me understand what was going on. And this is Dr. Edvard, another one of my best friends. So we were able to get some of his research. He gave an oral presentation at CUGH a few years ago. And then this other picture is of Dr. Edvard and his wife last year at his Harvard graduation for his master's. And, you know, I bring these up because these are people that I have a personal investment in aside from their work and their research, and it's just some of the best relationships I've ever formed. But it's not all work, it's also fun, right? The top picture is when my family came to Rwanda and met my best friend's family, and we all got to spend time together. And Dr. Edvard, on his first trip to the US, I got to take him to Target for the first time, which is very memorable. You know, seeing gorillas and having parties and whitewater rafting in Uganda. I mean, you know, most of us do this work because we believe in it, but it can be just as much fun as the hard work and long hours that many have spoke about. So my current work and what my fellowship project was is an infant warming blanket. So this is a non-electric, low-cost device that was developed with a biotech firm out in California to prevent hypothermia in neonates. Let me show you. So it is to be used in conjunction with the global standard of kangaroo mother care. We would never want a mom to remove her baby from her chest if that was providing adequate warmth, but for a number of reasons, the mom is having complications after delivery and isn't able to provide kangaroo mother care. It's a cold environment and it's not enough. The baby needs to be transferred to a higher level of care. There's power cuts at the institution. They just don't have enough warmers. There's a number of reasons why you'd need something else. So this allows, with phase change material and boiling water that you'd either do in a kettle if you had electricity or over a stove if you didn't, to make this warm mattress that's able to keep the baby warm for 8 to 12 hours. These nurses are some of my nurses up in Butaro, where we carried out part of the first stage of our clinical trial. We now actually, I missed the meetings last week in Rwanda, but are now expanding our warmer to use over the entire country of Rwanda. And I will say that currently this is a labor of love. This does not cover any of my salary, which I know it depends, you know, what kind of work you do if you have other sources. I see patients in the emergency room. But it means enough to me that I've decided to give my free time to it. And like I was up till 1 a.m. this morning working on our manuscript. So you find times for things that you still love, because I believe it will go somewhere. It's just going slower than I had hoped. All right, so here's a few other experiences I've had along the way that kind of have weaved into things. So actually, it was the year of my MPH about a decade ago. I attended the Livestrong Summit on cancer, not really knowing. I just had more time during my MPH than I'd ever had in medical school. I thought, hey, why not? You're going to pay for my trip? I'm poor. I like going places. I'll go. And then this next picture is a few years later with Dr. Larry Schulman, who was at Dana-Farber and is now at UPenn, and Paul Farmer, who would then go on later to become my mentors. And, it started out as a simple conversation there, and did not know that they would play such an integral role in my career a few years down the road. I've been very involved with Clinton Global Initiative, which at this time doesn't exist, but the Clinton Foundation still does a lot of work. They did a lot of global oncology work. So in addition to just meeting a lot of really influential leaders around the world, I also got to thank Jeff Gordon for providing the chemotherapy on my mountaintop, and interact with some of our former presidents. I won a fellowship to the UICC meeting as a young leader a few years ago and went down to South Africa, which has been a very impactful group of other young professionals that we still, again, I'm not even doing that much oncology, but I still somehow get roped into writing these opinion pieces from here to there. And, it's saying yes. I guess that's one of my biggest things, is looking for opportunities, really voicing what you're interested in, and not being afraid to approach people that you think are much more important and farther along their paths, and just sharing what you're interested in, because it leads to all type of experiences. I went to residency in Connecticut, and so Paul Newman has his original camp, Hole in the Wall Gang Camp there. And through people just knowing about my global health work and working there for a few years, I became the medical director of our 10 camps around the world in limited and resource limited settings, of which we work with 8 different of Baylor's camps, so that's how they wove back into my life. And so I actually go to Eswatini next week for camp, and this has become just another outlet for me to make a difference. While it is camp, it's really providing staff education on psychosocial services and other areas of wraparound services and care for kids with serious medical illnesses that otherwise wouldn't have the capacity to have their staff reach those parts of their life. And it has played a large role in my life. So again, be a yes. For me, that looks like having a bunch of different jobs right now. I'm 3 years out of my formal training, although I've been working as an attending for 5 years. So that means working at the Center for Global Health and doing things with public health and the School of Medicine and the Children's Hospital. I don't know where it's all going to lead, honestly. I don't. But I figure if I stay true to what I love and that I'm passionate about, and I keep doing all of these things, that my path will continue to carve its way. As I mentioned, camp has been a big thing in my life, and we have domestic camps as well as global camps, and so I go to camp and I play with a lot of the chairs of the different departments, and as they also come to support camp, and it's led to some leadership opportunities for me at the hospital, and it helps fill my cup and keep me excited. I recently went down to the University of Zimbabwe with the University of Colorado and looked into more pediatric oncology opportunities, and I'm trying to continue to find new avenues and ways we can collaborate with places that we currently aren't. When I go back to Colorado on Monday, I'll be hosting this community panel on Bending the Arc, which is on the work of Partners in Health. I got to go to the Sundance Film Festival and be behind a movie for the first time. And now I get to share what local organizations in Colorado are doing in the work of Partners in Health with the greater Denver area. And so, it's finding unique opportunities to showcase your interests and your skills, because you never know who's going to be in the audience or what newspaper story is going to come out of the experience that may lead you to something else. And mentorship. My last piece is just remembering the role of mentors. First, seek them out and have many. Have mentors about life outside work, have work mentors, have mentors for the different areas of your interests. Hold on to them. I I would say probably 2 or 3 times a year, I always reach out to my old mentor and just touch base and see how they're doing and give them updates. Because again, you never know how these experiences are going to weave in and out. And these are people that have dedicated time and interest into you, and that doesn't just end when you move on to the next institution. And my biggest takeaway is to give back to others. You know, I got to where I am because I listened to lots of people's paths, and I was not afraid to ask them questions and to see if there were ways that they could help me get to where I am today. And I believe that you, in turn, need to be willing to open yourself up to meet with people that are behind you and see how you can also help them find their way. So find your true north. Really figure out what lights you up, what excites you, what you're passionate about. You know, people often tell me I do a million different things, but the reality is I find ways to combine the people I love with the things I love. And if you can do that, then what often looks like work isn't really work because it's fun. So just stay true to yourself and you'll find your way. All right, I think that's all I got. Can you hold the microphone a little closer?
Yeah, so I had a question regarding volunteering your outside time compared to your work time. In terms of like resource-limited locations. And if you want to help out, but you're not really sure where to get the resources from, like for example, at the hospital, the Vinmec Hospital in Vietnam, I want to get them goggles so that they're prepared, you know, eye safety, in addition to better gloves, because they're using latex. They're not even latex gloves, I don't think, they're just the white gloves.
Yeah.
I'm not sure if they're suitable for the biohazards that they're handling every day. And I also noticed that the survey forms, they're processing it in the office, and I'm not sure if the subjects who are doing the fecal sample are handling the paper too, and if there are better methods for them to have a containment area so that the people who are working so hard to collect the data aren't seriously, you know, infected with any diseases while they're doing the work to help the population. And what advice you can give in terms of contacting people in the United States to have in-kind donations so that they can do the work they can do successfully, but also prevent health hazards.
Yeah, I think first and foremost, if you're involved with an academic institution, that's usually the easiest because you can find small grant funding, or you know, you can work with clinicians to collect supplies that you need. I mean, we have an excess of medical supplies in the US, and we also have kind of ridiculous expiration dates on things like gloves that don't really expire. So on a national level, I work with an organization called Project Cure. You can look them up, but you need to be able to have like the size of a shipping container to go to a hospital, so that's not going to be small or going to be feasible for your small glove collection. But there are certainly, Project Cure works across the country to, in hospitals and ORs and ERs, to have an area where, like when I do an LP and all the extra things on my kit that I'm not using, they then put there, and it goes through a whole bunch of logistics to get to where it needs. So especially for small kind of specific interventions, schools of medicine, hospital, usually within your own institution, you can find someone that would be interested in helping you, because you're right. I mean, little changes like that can lead to really big changes. And, you know, there are grants if you're going to do things on a bigger level, but it often starts on piloting it as kind of a little QI project locally to then lead to something bigger. But, you know, global health has become, in the clinical world, a very hot, interesting topic. So usually every medical school has some sort of chapter, and then there's a list of faculty that do work. So you could probably at least find people that are working in Asia, if not specifically in Vietnam.
Other comments, questions? So I was taking notes here when you were talking, because there are so many lessons learned from the story you mentioned, and I think there are lessons for all the students to learn from this experience. I think what you talked about regarding networking is very important. You have a large network of collaborators. You were in an environment where people introduced you to other people. I remember we introduced you to Melissa Bondi in Michigan.
Yeah.
Dr. Chamberlain and Dr. Bondi introduced you to David Poplack and other people. And that's how it goes, the networking and mentorship also. which is extremely important.
Yeah, and the piece I would add to that is, and I continue to learn, is that if you don't voice your interests and you don't voice what you're looking for, people can't help you. I mean, if it's someone that's specifically working on your project, they may know indirectly about you, but you really got to get clear on what you're looking for. And hey, I understand. I mean, I thought I was going to be a pediatric oncologist, and now I work in the emergency room. Like, plans change. I get it. And I also think that I'm the perfect example of doing a smattering of different things to kind of figure out my way, but you really do have to articulate what you want for people to be able to connect you.
For resistance and strengths, I remember when we introduced Leana to Melissa Mondi, she took Melissa Mondi to the airport.
Yeah.
She didn't
And
stop,
got a ticket.
She didn't stop talking to Melissa Mondi. She connected with Dr. Chamberlain about funding.
Yeah.
We were talking about her funding. She didn't remember what the details were, but the final outcome was that she got money from MD Anderson to work in Baylor. You connected with Palmer Beasley, and you pursued Palmer Beasley for some time, and then you connected with Baylor. Another issue that I took note of here is resourcefulness and connecting with people. And the Morocco experience was an amazing experience. They went to Morocco, they didn't speak Arabic, they didn't speak French, but they connected with Dr. Karkouri and Dr. Beneder up till now. She posted something on Facebook this morning, and Dr. Karkouri replied in 5 minutes. So this
10 years later.
This was an experience of connecting with people and finding a common line of thought between you and people, and I'm sure you're doing that everywhere.
Yeah, and the one thing I forgot to mention was even that my Morocco experience, they were collaborating with St. Jude. So when I was a resident in Connecticut and I couldn't find mentors in my own institution to do global oncology, I reached out to Memphis to St. Jude and I said, hey, I'm really interested in this. Oh, by the way, I lived in Morocco and I worked on with some of your collaborators, and they were like, oh, you're already a part of the family. Welcome back. And I mean, I guess for me, it's taken me getting 10 plus years down from my training to see like, wow, look at how all of that connected. And I know it's not magical and it's not coincidence. I mean, there is hard work and there's maintaining relationships, but I think if you're willing to put the investment in, and if you're doing things that you're passionate and you care about, it doesn't seem like as much work to stay connected because you enjoy the people and the experiences you had, and you just never know how they may come back to weave through your process later down the way.
For resistance and strength, she reminded me of the story of hospital molecular epidemiology. I forgot this story, but she came to me and said, I want to do CSP, and the hospital and molecular epidemiology said no. I said, I don't want to fight with the hospital and molecular epidemiology people. She said, don't worry, you are out of this. I'm going to do it. I'm going to finish it with them. And after that, they stopped admitting MDs to the program because of Leana, but she did it.
All right, thank you.
Other questions, comments? Thank you. That was wonderful.